My name is Dr. Lucas Nyabero, and I am the CEO of PSK, which is Pharmaceutical Society of Kenya. Most of these drugs are either psychotic drugs or medications that are used for surgery, or they're used to alter. This is under using with a professional using them. They're supposed to alter your perception of things like pain, and when doctors are performing specific procedures that could be painful or traumatic, so they give you some of these medications to reduce that. Some of these medications are used only in ICUs and very highly intensive areas where there's high care, because things could go wrong very, very quick. In pharmacy, we call it a thin or a narrow therapeutic index, which means a drug will move from being useful to poisonous very quickly by a very small amount, or from being useless to being useful. So it is the numbers, the lines where how much you should give has to be done by a professional and for specific reasons. The safety of any medication is about the dose. Everything that you take medication, the danger comes with the dose and how you're taking it. So for example, if you go back by the Mchele stories that you've heard, some people have been sleeping for 5 days, some sleep for 2 days, some 1 day, right? Depending on the dose that was put there. Now, the reason why people sleep 3, 4, 5 days, it depends on the dose and something else, it's genetics. So there's a special wing of pharmacists called pharmacogenetics, where we test your genes and see which drugs you should get. So you and your sister will take Tylenol for headache, or acetaminophen or Panadol for headache, and you will have different levels of relief. That's because both your bodies, your genetics are different, and you're metabolizing or using these drugs differently. So that's why some people will sleep more and less. The other reason why, and it could be a mix of all this, could be a cacophony of all this, it could be too much of what you're taking. It could be your body just doesn't take enough. It doesn't clear it well enough. And that's why the longer you have it in your system, the longer it keeps you under. And that's why you flush it out. So if you have a system where you're able to clear it out sooner, the better. Pray. So, because once you get to know that, once it gets into your brain, it's gotten in. You can't throw it up. You can't say it's in your belly, let me throw up. No. Once it's in the system, it's in the system. It started working. It just attaches to the receptors. The key thing is not to get it, but if you get it, hoping that you have a friend or somebody else who's going to take care of you. That's why now they're quote-unquote drinking buddies. Go with somebody who knows where you are and can vouch for you and see what's going on. I think that's the best way to do it. Non-registered facilities will do things that are not kosher, things that are not right. So if you're registered, then it's easy for us to follow. A few other things we have to do is, how do we make sure every prescription medication, you need a prescription to get it? Same things happen with antibiotics. If you go down the line, antibiotics, pain management, and all these other things, if you do not insist on a prescription, it means the patient doesn't have care. Nobody's taking care of that patient. If nobody's taking care of that patient, is that medication theirs, or does it belong to nefarious? Is it being picked for nefarious purposes? Why are you buying a medication if you didn't see a doctor? These medications that they're talking about, that they're using from Mchele, they're very unique medications. Some of them you can't use them over the counter. They're really, really unique medications. And for you to get them, you have to have several visits with a physician to understand exactly why they're giving them to you, and what dose and when you should take them. Other than that, When you sell those medications without a prescription, you should go to jail, because you are actually selling things out. You're sending things out to the market that without any safety measures. Because nobody should be able to buy those medications without a prescription. And not only that, I should be able to pick up the prescription, call the doctor and talk to the doctor and ask the doctor, why are you giving this? And if the doctor doesn't want to say, you say, no, I'll not fill it. I'll keep the prescription, I won't fill it. Now, the law enforcement and the regulators now, this is where now they support and bolster pharmacies to say, when you do that, we will have your back. We will take care of you. We will support you when you decide to take a stand like that. What is coming out, what you find out, is mostly the ones that they use for veterinary purposes. And they can go there and buy that. Same thing. Why is anyone selling a medication that is that potent, that dangerous, without a prescription? A prescription pretty much says, hey, I am the provider, I checked the patient, they really need this medication, they should have it, not just willy-nilly, but they should have this amount every 3 times a day, once a day, twice a day. So then it is a dog on a leash. So it's going to do what you're telling it to do. When you just let it go and somebody comes and buys it, goes and uses it, it is a dog without a leash, and it can go anywhere, bite anyone at any time. And that is what is happening. And the people who do these things, if they can understand the devastation to families that they do in terms of resources. So if they steal all my money, I have a family that I needed to take care of. If I was willing to buy you a drink, I'm buying you a drink because we're in a social place and I'm being kind. We were raised to be kind. So if I share a drink with you and then you poison me, that's interesting as it is, because it is like, but people who get injured. Now we see the people who come and talk about it are people who get in, go through whatever it is, and then they come out. Mm-hmm. There are people who can permanently be injured. It can cause permanent amnesia. Mm-hmm. You could lose your memory completely. There are a few other things that could happen. So if you're actually willing to do that for a few shillings, okay, then you have an issue, and let's deal with that issue. But the thing is, I don't want to be complicit, and PSK members who are pharmacists who have actually gone through the ethical, the code of ethics, they understand it really well, understand the importance and the risks of doing things like selling these prescriptions without a prescription. You should get a script of who is managing this patient to sell those prescriptions.